We can improve our health and well-being by addressing these deficiencies through proper nutrition and supplementation. If you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell so you never miss an update on health tips, recipes, and wellness inspiration. Vitamin D deficiency can manifest in various ways, including fatigue, muscle weakness, bone pain, and frequent infections. Inadequate levels of vitamin D can also significantly impact bone health, leading to conditions such as osteoporosis and increased risk of fractures. Furthermore, vitamin D plays a crucial role in supporting our immune system, and deficiency can compromise our body's ability to fight off infections. If you suspect you may have a vitamin D deficiency, there are practical steps you can take to address it. Increasing vitamin D-rich foods such as salmon, tuna, and fortified cereals can help boost your levels. Vitamin D supplements are also available for those who may have difficulty obtaining enough vitamin D through diet and sunlight exposure. Consulting with a healthcare provider to determine the appropriate dosage is recommended. By recognizing the signs of vitamin D deficiency, making dietary adjustments, and considering supplementation when necessary, you can effectively manage and prevent vitamin D deficiency, promoting optimal health and well-being. Stay tuned for more tips on optimizing vitamin D levels for a healthier lifestyle. Iron is crucial in bodily functions, including oxygen transport, energy production, and overall health. In this segment, we will examine the causes of iron deficiency and explore practical strategies for managing and preventing it to support optimal health. Iron is essential for producing hemoglobin, a protein in red blood cells that carries oxygen from the lungs to tissues throughout the body. Iron also plays a crucial role in energy production, DNA synthesis, and immune function. Without an adequate supply of iron, our bodies may struggle to perform these essential functions, leading to various health issues. Iron deficiency can occur due to various factors, with poor diet being a primary cause. A diet lacking in iron-rich foods such as red meat, poultry, beans, and leafy greens can contribute to low iron levels. Blood loss from menstruation, gastrointestinal bleeding, or other medical conditions can deplete iron stores. Specific absorption issues, such as celiac disease or gastric bypass surgery, can also hinder the body's ability to absorb iron effectively. To address iron deficiency, incorporating iron-rich foods into your diet is essential. Foods such as lean meats, seafood, beans, nuts, and fortified cereals are excellent sources of iron. Iron supplements may be recommended for individuals with severe deficiencies or those who have difficulty meeting their iron needs through diet alone. Making lifestyle changes such as avoiding excessive caffeine consumption, inhibiting iron absorption, and pairing iron-rich foods with vitamin C-rich foods to enhance absorption can also help combat iron deficiency. By understanding the causes of iron deficiency and implementing strategies to increase iron intake, you can effectively manage and prevent iron deficiency, supporting optimal health and well-being. Stay tuned for more insights on maintaining healthy iron levels for overall wellness.